Okay, so asthma is a really, really horrible disease. I am really frustrated by the way that it impacts people's lives. But one of the things that I am noticing as I just come across more people in practice is that there are still a lot of people out there who are unaware of some of the changes in the asthma treatment guidelines. One of the things that the Gina initiative, which is essentially, the World Council of all things asthma, one of the things that they've come up with recently is a change from your normal rescue inhaler. If you are someone who's had asthma in your family or in your own personal life, you are familiar with albuterol. Albuterol has been the gold standard for probably longer than I've been alive. But just in the last couple years, we've actually had a change to where they are now recommending that asthma should not be treated with a rescue inhaler of albuterol, but that if you're needing a rescue inhaler, it should actually be a combination inhaler with a LABA and an ICS. Now, a LABA, for those who are unfamiliar with the abbreviation, is a long-acting beta agonist. Okay, so a SABA, which is where albuterol falls in, is a short-acting beta agonist. And this combination medicine, the theory being that if you are having such a hard time breathing that you need to have a rescue inhaler, it would be a good idea for you to have a longer effect of that. And it'd be a good idea to add some steroids to try and have two mechanisms of action trying to treat the issues that you're having. And when they did studies, they found that this was a way to reduce exacerbations in people by changing from albuterol as a rescue to this combination inhaler. Now, the ones that they tended to use, the budesonide and formoterol, the brand name for that would have been Symbicort at the time. There is now a generic out, and if you are just buying cash value from your pharmacy, GoodRx puts branded Symbicort somewhere around $350 an inhaler, which is very expensive. I'm not going to lie about that. And a generic budesonide formoterol comes in somewhere in the $250 range, so it's a little bit cheaper. But there are now guidelines of steps for what you would use, and for essentially step 1, and 1 and 2, you would basically use this rescue inhaler, this Symbicort, this budesonide formoterol, whenever you needed it, much like you would use an albuterol inhaler. So instead of carrying your albuterol inhaler around with you, and if you have asthma or one of your friends has asthma or your kids have asthma, they should always have access to their rescue inhaler. But instead of having albuterol, they might carry this combination budesonide and formoterol, which is Symbicort by brand name. So that would be step 1. Step 2 would be that they would go ahead and use that same medicine, that low dose ICS LABA, that low dose Symbicort, as both their controller and as their rescue. So they would take that daily, plus whenever they felt they were having an exacerbation, much like they would with an albuterol. And if that got worse, you could increase the dose and go to a medium dose of the combination medicine of that Symbicort. And if that medium dose ICS combination with a LABA wasn't enough, if that medium dose wasn't enough to control, then you would start adding on a third medicine called a LAMA, or muscarinic. The generic of that would be a tiotropium, also known as Spiriva in a lot of cases in terms of branding here in the US. And that would be the progression you go. And if you get that far, you probably should be talking to a pulmonologist about some very specific testing. I also noticed that there are a lot of people who believe they have a diagnosis of asthma because they had trouble breathing once, someone handed them an albuterol inhaler in their life, and it's just really never left. And they've never done actual pulmonary function testing. They've never done any of the objective testing beyond saying, yeah, I have some shortness of breath and I take albuterol, and they're just diagnosed as having asthma. And if that's been where you're living and that's been your medical history, it's probably a good idea to check in with your physician and try and get some objective testing, make sure we're treating the right thing. And that's the thing that you should probably be aware of. So if you have asthma or someone that you love has asthma, it was probably weird hearing a physician saying, hey, maybe you don't need albuterol because you need something different. The Gina guidelines, again, that's the Global Initiative for Asthma, they have suggested, and so far, this seems to be a reasonable treatment change. A big one for those of us who've been doing this for a while. I am new, so this isn't that new to me, but this is a big change for people who've been living with an albuterol inhaler in their purse or in their pocket for the last 15 years, right? So talk to your physician, see if this is right for you, because if you are carrying an albuterol inhaler for asthma, it might be time for change. Stay safe out there, y'all.